chicken thighs. That's okay. We'll talk about that later. Um, so, without further ado, I'd like to introduce to you Miss Angela Gumby from the Department of Health. Ms. Angela Gumby is a native of Harrisburg, PA. She graduated from the Pennsylvania State University with a degree in humanities and a minor in business. She currently works for the Commonwealth of Pennsylvania Department of Health, DOH, Office of Health Equity as a public health program manager, leading the Community Health Organizer CHO program. She has also worked for the DOH Bureau of Maternal and Child Health and the Department of Human Services Bureau of Claims Management for 12 years as supervisor of the Implementation and Planning Unit. Then 6 years as a Human Service Program Specialist Liaison for the Medicaid Prescription Drug Program and other program areas, including processing systems, procurement. Well, that's a tough one. Okay. Prior authorization, provider enrollment, third-party liability, program integrity, inpatient and outpatient claims, procedure codes, and editing and auditing programs. Early in her career, Angela worked for Capital Blue Cross and Pennsylvania Blue Shield Highmark for a total of 8 years in several capacities, including customer service, quality control, and interplan teleprocessing. The Blue Card Program. Angela is an active member of her church, which is located in Steelton, PA, and has served in the music ministry as a pianist, singer, and choir director for over 25 years. We got entertainment today. Yeah.
All right now. Hallelujah.
She is also a youth mentor and a member of Delta Sigma Theta Sorority Incorporated. She is the proud mother of two adult children, Danielle and Napier. Napier. Ladies and gentlemen, without further ado, I give you Miss Angela Gumby.
All right. I'm not sure what happened to my display here.
Oh,
Yeah.
Slept again. I'm so sleepy today.
I'm telling you. It's like me. Okay, while that's warming up, thank you so much for that introduction, Sharice. We were already welcome to the conference, so now I want to take the time before we get started to thank Sharice and her staff, the Metamorphosis Women's Empowerment Initiative, for this invitation to participate in what has been another awesome event hosted by this great community organization. Am I supposed to do something here? Make it go? You want to reboot it? I'm actually a little nervous today, and as many times as I'm in front of people, singing, playing the piano, doing whatever, it's kind of like, a little out of character for me, but, we have some pretty tough act to follow. Not that it's a competition or anything, but,
Don't worry,
we're going to talk a little bit about some things related to state and government programs, and just kind of bring it all together under the umbrella of health and wellness. Physical health, mental health, and some of the things that we talked about earlier today, because those things feed into, like Sharice was saying earlier, to what happens to people physically, emotionally, psychologically, spiritually, financially. I'm going to try to do this thing one more time, one more try. It worked a few minutes ago. doesn't help that my director's here, so. So he's going to be facilitating on one of the panels here in just a little bit, but thank you so much for being here, David, for your support, for your leadership. And I also want to acknowledge Francis Fair and where you at? Elizabeth Feddison. And then I'll tell you a little bit more about how we got introduced to Charisse and Metamorphosis.
Sorry.
That's all right.
If it doesn't work.
No, it's going to work. Oh, baby. All right, it seems like something's about to happen here.
There we go.
All right. Now you can go either way.
Oh, no,
Still kind of taking its good old time here. Well, you saw the first slide, so. Don't tell me it decided not to work with us here.
Probably tired after lunch.
Yeah. It had one too many chicken thighs. I was sitting with
It's the
Charisse.
cupcake that tipped it
She's
over.
right behind me.
You had a cupcake?
We just make sure the net works. I'm just gonna go back and see if I can reconnect to the Wi-Fi.
Do you have a hotspot on your phone?
Now that's something to ask my kids.
You have to put it next to the window.
Okay. I think I can reconnect here. Let's see what it does. Yeah, because some of the things, it's gonna be a little bit hard. Just give us, bear with us just one more moment here. You're good. Now, see, I only got to have 2 chicken thighs because I was rushing back here to get this set up, so.
Simple minds, right? They say.
Yeah, it's a
It's copy. Copy of the part.
Still searching. Okay. Got it?
You have its copy? Yeah. Can we try it from this computer?
Sure.
Yeah.
Okay.
I can only think that it is Bluetooth and it can probably
Yeah.
Bless you. Thank you.
Now is working, right? Do you think?
Oh, yeah.
had the file.
Okay,
So
go ahead. And then I'll just run it from here. Be able to read some.
I'll be with you the whole time.
Okay.
We're connected.
Just trying to make the state look bad, that's all. We're not here to be a watchdog or anything like that. Sharice is an awesome community organization and partner to partner with. So I'll talk a little bit more about that once we get into just a few of the items. All right, there we go. We're back in business now. I think that was good anyway to get, that food down to the next chamber. Hopefully everybody can stay awake. But I just borrowed this slide from the information that Sharice had provided in the staff. I thought it was really neat. And just something to highlight because of what we're talking about today, about releasing the shackles. So we'll do a little activity in a bit to just kind of talk on that vein. Go ahead, next slide, please. Again, we're with the Pennsylvania Department of Health, the Office of Health Equity. I am the manager of the Community Health Organizer, or CHO program. I refer to the staff as the chosen ones. We have a staff of 35 as our capability, but we have 32 people who are all throughout the state, field staff out in their communities. And these are people who live or work or worked in these communities. So this isn't just about the Department of Health. This is about all of us. Each one of us has a connection to, in my case, I live in Dauphin County. So we have a community health organizer in that area, but I'm able to, David, our manager, is able to go out and to meet and connect with those in the community, the organizations that are doing the work, the ones that we need to hear from, the ones that during this pandemic, and I say right now we're in this transdemic because the pandemic really isn't over. It's something that will probably be with us for the rest of our life in terms of COVID, but it just raised awareness about emergency preparedness and about health and wellness and about what can happen when you're not prepared, when something of a public health emergency or public health focus comes up and it has to be addressed. Not just here in your community, not just in the Northeast region of Pennsylvania, not just in Pennsylvania, not just in the country, but worldwide. And so this is unprecedented, these times that we have been in. So we want to talk a little bit about some of those things. And again, just kind of tie some of the things that we've been talking about today and hopefully release some shackles. I'll never forget when I met Sharice, and we're about to have a birthday, our anniversary, Sharice. It was April the 1st. I was in Lehigh Valley with another worker, and we were doing a presentation to the Lehigh Valley Business Women's Chamber of Commerce. And Sharice came up, and we had a table with a tablecloth, the Department of Health. And she said, "Woo!" She was so excited because she said, "I have been waiting to meet someone from the Department of Health. I came here just to speak to someone, just to meet someone from the Department of Health because I have some things that are going on and I need your support." And I thought, whoa, okay. We were a fairly new program at that time. We had just started hiring people and bringing them on in these counties across the state in October of 2021. So I was kind of, thinking to myself, uh-oh, what are we going to get ourselves into here? But Sharice, we're so glad that you found us. We're so glad that we found you and we've been able to connect. As I said, Francis and Elizabeth and some of their family have come to work with some of the programs that Metamorphosis is doing out in the community. We actually came to the Women's Health Fair last year to do some vaccinations and you had health and wellness information for women's health, topics that women struggle with and deal with, on the physical side especially. And it was just a really good time. And you don't have to be an organization of, 500 or 1,000. You can have a staff of one or two or five or 10, just a very small staff. But if your focus is serving the community, those in the community who have needs, then that is something that the Department of Health wants to show. We want to come to the table. We want to hear from you. We have some forums and platforms, and maybe David will talk about them. We have a health equity action team that we hear a lot of good presentations, a lot of good information on some of the very topics that some of the resource tables are out there talking about, drug and alcohol, other types of issues like homelessness. So United Way with 211 and those types of services. We want to try to be like that 211 of the Department of Health, to kind of be there for you as a community, as community organizations. And that's where the community health organizer comes from, that we will meet with you, that we will partner with you, that we will find out what is it that we can help you do, especially with this pandemic, because of any type of funding that has been lost, or your volunteer networks may be down. We can come and help you and try to help set us some mitigation strategies and share any resources and information, opportunities that we have at our fingertips that you haven't been able to get to. And maybe it's not because you're not trying to do your job and you don't want to, get to those resources to serve people. Of course, it's the opposite. You want to. And so whatever we have, we can talk to you. We can say, Sharice, what is it? And I know one thing that she shared with us before is about the van, because of the terrain here and the way geographically things are laid out. You can't just go down to the corner, a block or two and catch the bus. And so with the Everybody Eats program that you're serving in the community, that's something we want to be able to help you, if we can, to point you to some of those grant opportunities and things that, there's a lot of money out there to be had. It's just, you don't know what you don't know. We may not know what we don't know, but we're certainly going to try to hang in there with you so that you can get to those resources and information. And I really like that concept where Sharice is talking about, tailoring it to the needs of the family, the individual family, because we can't always assume that what we have is something that someone needs. You want to give them a choice. It's about choices. And at those times when we can bring that level of choice to people, that's what we want to do, so that there isn't as much waste. And so people don't think, well, the state just came in, they're trying to take over, they're trying to scrutinize, and they just want to see what we're doing. But all they had was this to give us, and that was it. And we never heard from them again. But we've been, for the last almost year, hanging in there with Sharice, supporting as many types of events and things. And I'm just thankful to Elizabeth and Francis for being here in this area to be able to do that. We say that for our program, it's hard work. It's not some posh state job, but it's hard work, because these ladies will come on the weekend, it's Saturday, you could be out doing anything with your family, friends, but their work does not end at 4 o'clock or 4:30 or 5 o'clock. If Sharice calls, we'll say, hey, what do you need? We'll check with the staff. We'll see if we can send somebody out to help. So you might be saying, I heard a lot of this, and you're repeating some of the things that Sharice said, but I want you to know this, because my question to you is, why is it important? Why is it important that the state, a government program, is able to come to the table with the community level organizations? Anybody? How do you feel about that?
Because it affects the families. When you have families that are thriving and intact, excuse me, thriving and intact, that's where the community flourishes. So if the state don't provide certain programs or services, then you're gonna have maybe child abuse rates, prison, poverty, and everything else. So you need the state to come to the table so you can know, just like what Cherie said about them going and getting what they want. So you can know the needs of the community because each community have its own set of different needs.
And you just summed up what we've been doing now for about the last year and a half in this particular program. Because we want to be like that public health concierge type service. Now, we can't reach everyone. We can't make promises, and we're not going to make promises that we know we can't keep. But what we'll do is we'll keep that listening ear. We'll keep that open heart. And again, it's not just because it's our job. It's because it's our job to serve our community that we live in, that we're a part of. And it does get down to not just that state level, not just the regions of the state areas, not just that particular county, but those communities and the individuals there that are suffering, are struggling. Go ahead, next slide. Okay, I'm taking the next few points directly from my conversation with Sharice. When I asked, well, what do you want me to talk about? What do you want, the state to bring to the table in this conversation and talking about health disparities, which we'll talk about some key terms and definitions in just a moment. And she said exactly what this young lady said over here. She said, I want you to partner with this community-based, community-focused organization and help me remind people that in this space we refer to as public health, we need to have sensitivity in, not on or around or anything like that. We need to have sensitivity in our approach. And thank goodness that when I got dressed today, it wasn't like a one size fits all. I went to get a t-shirt, I needed, something for a little more delicious woman. And that's how we want to be. We don't want to have just a one size fits all approach. Now, for certain policies and procedures and things, it will start at those levels. They may talk about, some of that, but we're trying to have engagement staff and we're trying to, be there for you. And not just for the short term, but for the long term. So we want to have that sensitivity in diversity. We also want to recognize that working with people is something that, it's not easy. It's something that, again, you have to have some education, some experience, but really the biggest thing you have to have is that heart. And you have to, want to be able to be there with and for people, and in a non-judgmental way, in a way that says you matter, in a way that says we're listening, we're trying. So the other thing is when we look at public health from the people perspective, it's about the needs perspective. It's about having more efficiency and respect to serve, not assume, not dictate, but to hear from people. And then the other thing, if you can move to the next slide here, is what I've been talking about, just to visualize it at a few points. We can do this by opening up the conversation with you through leaders in organizations like Metamorphosis and those who are out here with some of the resource tables and information, who are here to serve by understanding and providing services in an equitable manner. Next slide, please. Okay, so we're going to talk about some key terms and definitions, and I'm going to ask Elizabeth and Francis to come up and just kind of help me to field some of these questions, just to open up the discussion and see what your level of understanding, how you feel about some of these terms that now have become so mainstream that we hear so much, because public health is definitely here to stay. 10 years ago or so, it was kind of loosey-goosey the way some of the data was collected and information was distributed and disseminated. But now, public health, there are so many colleges and universities that have this as an actual a program, academia, masters of public health, et cetera. You can do so much then within or under that umbrella. So we're going to talk about some of the key terms. Next slide, please. All right, you have the microphone?
Oh.
Hello.
Okay.
Go ahead, Linda.
All right, so we answering your question as well as answering the question. So what is equity versus equality? Angela?
That's the question.
Okay, I did ask the question. Am I answering the question? I am answering the question. All right, so health equity. It is the am I reading this one? I'm sorry, reading that.
We're going for here. I really want to know if anybody has any thoughts on equity versus equality, especially when you see something visual like this. Any thoughts on equity versus equality?
So equality has the access to the same thing, whereas equity is everybody has the opportunity to access the same thing, just in a way that meets their need.
Meets their needs. Right. Yeah.
Very good.
Okay, and so in this particular slide, we're showing that because if you look at equality, everyone gets the same bike. But if you look, everyone has a different physical situation that doesn't allow them to enjoy the bike unless the bike has certain modifications, whether it be a height modification or something with the style of the bike, etc. But everyone can now have the enjoyment of riding the bike because they have a bike that's tailored to their needs. Go ahead, the next one.
What is health equity? Does anyone know?
Health that's geared towards your needs.
Okay, we're going to look at a couple of definitions. We're going to make this just kind of textbook. American Public Health Association, the APHA, defines health equity as everyone having the opportunity to attain the highest level of their health. And I think you kind of said that in your response. So it's not just that we want you to be healthy, but we want you to be your healthiest. Okay, so then the CDC talks about health equity in terms, it says that it's achieved when every person has that, again, the opportunity to attain his or her full health potential. So not just the highest, but their full health potential. And no one is disadvantaged from achieving that potential because of things like their social position or other socially determined circumstances. And finally, the Robert Wood Johnson Foundation says it means that everyone has a fair and just opportunity. Some social justice and things in there that this requires removing obstacles from health, such as poverty, discrimination, circumstances, powerlessness, and the lack of access to good jobs with fair pay, quality education, housing, safe environments, and healthcare. So those are some textbook definitions of health equity, but we just want to point that out to you because when you hear those terms, equity versus equality, they're not the same. And there's a reason that they're not the same, because we have to account for those differences, for those needs, those specific needs.
And so you had someone that wanted to make a statement.
I'm sorry.
No, I was just wondering why nowhere in any of these definitions racism is, why it's not included as a barrier to health equity, and why that's not named or listed in any of these.
I think because we're in the next set, I think when we talk about some
Social determinants of health.
Okay.
and
It would be
health disparities. And social determinants of health.
I just find it interesting that all these governing entities do not name it.
Okay, let's see if we can look at a couple other definitions and see how they kind of tie together. We're gonna kind of-
Those are kind of old.
Okay.
Those are probably, I don't know, 3 to 5 years old. That's probably why too.
Okay.
Wasn't as prevalent as mentioned.
Yeah, we'll weave them in though too. Go ahead, next slide. So what do you think health disparities are?
Barriers to access.
Well, like my son is transgender, and there are no doctors that are familiar with how to treat him. So he's treated differently than most others when they go for healthcare.
That's a good example. Anybody else?
No, but mention now, so her son is transgender. The fact that he's transgender and he may be treated differently or he can't find care close to him is one thing. But what health disparity speaks to is the difference between outcomes for, say, someone that's not transgender and someone that is. And that's the health disparity. So the transgender community, there may be a higher level of lung cancer because the LGBTQ community tends to smoke at a higher level. So their health outcomes might be different than someone that is not in the LGBTQ. That's the health disparity.
Yeah, I think we'll see some of that in the next, you can go to the next slide. And I think you pointed out, with the differences, we talk about disparities in health, and they're unnecessary, unavoidable, unfair, and unjust. And like David said, that's a little bit old, but it just goes on to talk about how certain groups are adversely affected because of systematically experience greater obstacles to health based on those types of things. Could be racial or ethnic group, religion, socioeconomic status, gender, age, mental health, all those things, physical disability, sexual orientation or gender identity, geographical location, and other characteristics that historically are linked to discrimination or, exclusion. So that's a lot, but I think the key things to point out there are, differences, and that there are certain groups that have experienced obstacles just because of who they are, their age, something, physical or mental that's going on with them, etc. So let's go to the next question. So now, what are some social determinants of health? Or what do you think when you hear social determinants of health?
All the factors in someone's life: childcare, transportation, housing, financial, education, employment, all those things that impact health.
Okay. Anybody else? Or just go to the next slide. So those are those conditions that people are born into, and they're that where they grow, work, live, their age, the forces and systems and things that can shape the conditions of their daily life, things just like what you mentioned. And we'll see a little bit in the slide that some of the things that our program focuses on, because it's something that you see with a lot of prevalence. And here in Monroe County in particular, transportation, access to transportation or lack of access to transportation, to be able to get to not just the doctor's office, maybe you don't even have the PPE up this thing, and I are gonna fight. But that you can't, get to some fresh food options. So the food insecurity, food deserts and things. Again, access to healthcare providers and services, just educational information, awareness, and some of those chronic conditions and diseases and things. And I know when Therese had the women's health fair, focused on some of those, doing the blood pressure screenings, doing the cholesterol screenings, the mammograms and things that focus on, and we'll point out some things particularly in a little bit about women's health issues. Not that men don't have issues, but just because, the focus was on women, But on either side, you can have those things, and they're creating barriers to get to that highest level of health. Next slide. So a couple more definitions, just talking about healthcare, the field that is concerned with that maintenance and restoration of your health, whether it be mind or body, procedures and things, and what goes into being a healthcare provider in order to do that. But also with our program, we focus on some vulnerable communities for those who maybe don't have a voice or who have been either oppressed or had difficulty getting to services because of a disability, because again, something mental or racial or ethnic. Maybe you're a senior, older individual. Maybe you're an immigrant. You come from another country. If you weren't born here, but you've come here and you're living or working. We have a lot of migrant populations and things like, especially in the growing season. These are folks that can be forgotten. LGBTQ plus children with special needs. So we want to think about those vulnerable populations to be able to assist with some of those vulnerabilities. And organizations like Metamorphosis are here to help to do that. And then vulnerable places or communities with those inequities in social, economic, educational, physical environment, or environmental health issues and things that have insufficient resources or capacities to protect and promote the health and well-being of residents. And sometimes with vulnerable places, you will see some of the more vulnerable populations or communities, let's say, closer to some type of treatment plant, where there can be some environmental, hazards and things that could come into play. I know in the Harrisburg area, where one of the treatment plants is, my friend said they would come out in the morning and there would be like black soot on their car. And then you wonder why in that zip code, we call it a health equity zone, where the health outcomes are poor now because of those environmental influences, because of that type of pollution and things that they're more exposed to. So children have asthma at a higher rate. And so that's something to think about here in Monroe County. I know there's a report that came out. For the next slide. I'm going to talk about Pennsylvania and then Monroe County just at a high level, just kind of briefly. Go ahead and just kind of sum up some of those social determinants of health, some of the things that, we talked about, the socioeconomic status, education, racism and discrimination, food insecurity, nutrition, housing, the built environment, access to healthcare, and then environmental hazards and safety. But if you go to the next slide, this comes from one of our state of health equity. There was a 2019 report, and some of the data is a little bit older, but a lot of the trends and things are still, proportionate to what's happening now in the populations, even if the population has decreased. Still seeing some of these trends. So these are just graphics and things out of that report to show you that, we can't take our finger off the pulse. We can't take our, like David would say, our foot off the gas pedal, because we want to be able to make sure that we're thinking about some of these things and who it's impacting the most. The other thing is Monroe County, they have a community needs assessment. And I was looking at that, and you can go out to the website. There was a 2022 version that just came out. And that was something that, was showing the breakdown of some of the things like the median income of the household, showing the different populations that are impacted in different ways when it comes to health and wellness. You're gonna have to excuse me for a moment. I have to sneeze. Sorry, I was really obnoxious sneeze, so I wanted to warn you. But in that community needs assessment, you can find out, publicly what is going on in your county. And I challenge you just to go out and, depending on where you live. Now, this assessment brought in Pike County, which our community health organizers don't always serve one county. They can serve multiple counties. So Elizabeth is serving Luzerne, Lackawanna, and Pike, but she lives here in Monroe County. Again, she's worked in those counties in a capacity as a medical assistant and some other things. And so, she traveled and had familiarity. So it was a toss up whether her or Frances, who Frances actually lives right there on the edge between Northampton and Lehigh County, but is close enough here as well to do work. And she has another capacity. So she serves Monroe and Carbon counties, but in this particular report, sometimes counties are linked together. And I know with this area, with so many transplants coming from maybe New Jersey and New York with the tri-state, you can get a more diverse population, people who didn't grow up in this area, they come here and it's more of a rural county. You have the trees and you have the roads and things like that. You can get a different experience, for yourself, for your family. But, again, that can create some challenges that you may not be used to if you're coming from mass transit, things like that. But those two counties are in that report. And again, I would say, go ahead and investigate. There's also countyhealthrankings.org. And that was saying that Monroe County is 38th, I believe, out of the 67 counties. So it's a little bit, past the middle as far as health and wellness when it talks about health outcomes and health factors, looks at things like the prevalence of smoking, if it's higher than the Pennsylvania average. And, in a lot of areas, Monroe County is slightly higher than those averages. So, that's where you might want to, as your organization, put some focus, not just with, if someone is food insecure, but they're also smoking, that might be something, that you have some services and support or partner with a health system or a federally qualified health center or rural health center or something to be able to help them, to again, reach their healthier status. But smoking prevalence was a little bit higher, access to physical activity, which again, of course, just because of the way things are laid out. Go ahead.
Can you please say again where we can get these reports? Because I'm highly interested.
Sure, you can get them right online. I'll send the information to Sharice. It's 2022 through 2025. They have estimates and information about Monroe County. It's the Monroe County Community Needs Assessment, which counties do, and they usually do them like in a 3-year block to be able to provide that information. It's about 190 pages, but the way they break it down into sections, the table of contents is pretty good. And you can look for, those topics that are of interest to you.
Thank you.
You're welcome. And the other thing was countyhealthrankings.org. And that's all one word, County Health Rankings. So our team uses some of those resources and things. We'll go to that data because the data kind of helps to lead you to where there might be some issues. But at the end of the day, once you start peeling back the onion, you could be in a county where one community is just one zip code over from another community, and they have totally different needs. They have totally different economic status. Go ahead.
Is the community needs assessment the same as or different than the CHNA, the community health needs assessment? Are they the same?
No.
No?
I don't know exactly what she's referring to.
Yeah, if I could display it,
Are you referring to the one done by the commissioner's office?
yes.
That's different. That's
So it's the CHNA through St. Luke's is different than?
Yes,
Okay.
I was about to say, when you
Okay.
look at county health, it's slightly different. And that's why I think Pike County, you'll see, is
Okay.
listed in there. They're kind of grouped together, and sometimes, because I know like the populations and things, some things are similar. There's about 168 to 169,000, the population here in Monroe County, but with the different boroughs and municipalities and things, again, if you look in those different areas, some, the median income could be 50,000 in one area, but 20,000 in another, just, like a mile or two away. I see that, I know, and where we live, where David and I in Harrisburg, you're driving up Market Street, I'm telling you, by the time you hit 20th and Market, it becomes a whole different landscape because there's an exclusive neighborhood right there where doctors and lawyers live, 2, 3 blocks down, you know, it's a more vulnerable population. Yeah. Go ahead.
Is there a way that we can support and protect? Only because a lot of people who need resources and a lot of people who could benefit from, outreach, some of them are afraid to accept help. It's like you guys do have a lot to offer, but certain demographics are all about family and community and staying together, right? And then a lot of things that are offered is actually counterproductive to family. First of all, you have to open your household up to a system, which is crazy. And then you have to tiptoe around like the gray areas of how many people are in your household. You can't feed, because asking for help for food is very thin on the line of I can't afford to feed my family, which is neglect, right? So then you have mothers who are afraid to speak up and say, I need this, because in the same point, it's like by saying that you need this, you could be in trouble, and nobody's about to lose their baby. You're gonna figure it out, right? And this is coming from a person who, obviously, during my time, I had welfare, I had like the healthcare, I had all those things, and then you guys heard how my story just kind of unfolded. Learning when to actually say, hey, I no longer need welfare, I no longer need food stamps, like that transition, because oh, now you make too much. But when I began to make that much, I still didn't know how to manage my money in a way where it showed that I made as much as I did, right? So do we have outreach programs that educate and promote family, like even down to getting like food stamps and what is that stuff called? Like that type of stuff. It's like, well, is there a man in the household? Because if there's a man in the household, we won't give you this. But it's like, so do I have to choose between support or family? Because just because a person has a man doesn't mean that they're financially stable yet. Not saying that they won't get there. But what do we have for like community initiatives? I feel like the more that we involve ourselves with certain programs, that takes away the family dynamic, which is not worth it.
And people are feeling like they have to maybe fudge a little bit, and they want to be honest. And the percentage of women and children and elderly and things like populations that you think it's not just urban, minority, populations who are on these assistance programs. And I'd like you to speak, but I also like to ask our when you're done, Frances, to talk a little bit, because she knows a little bit about the emergency declaration and how that it might speak to exactly what you're talking about. Go ahead.
So some of the challenges that I see with the population that I work with is they might make just over that threshold. $1, $5, $28, so they lose their food stamps or they lose their medical assistance, and then that's $250 out of their pocket now that they are now spending on food that they didn't have, and their income that they're now receiving doesn't actually cover that $250. And so they're upside down in their resources and income. And so it leads to people fudging their information because they know that if I report this, I'm going to lose this resource, but I can't afford to pay for this resource on my own without this assistance anymore.
Yeah.
And so it kind of leads to this awful cycle for folks that end up having to stay in the system just to survive. And that, and then God forbid you say, I make this money, well then you're frauding the system. And so I think people are scared about actually reporting what they're receiving and what their household composition because of those things. I'm going to lose this and I can't afford to lose this.
That's kind of one of the reasons why our program is really important and why organizations like Metamorphosis is important, because with the emergency declaration, what's happening right now, which, Frances can give you a little blurb about what she's seeing on the other side when it comes to health plans.
It's very heartbreaking because right now, many people were able to get Medicaid during the pandemic. Right. They got they had the federal public health emergency assistance through the government. That was passed in December of 2022. And as of March 31st, over 500,000 people in Pennsylvania are going to be sent a letter that they're no longer eligible for Medicaid. And what happens to those people? Well, they say, this is what they're telling people. Okay, well, we don't want to leave no one uninsured. But the problem with that idea is that every other program is income-based. and not by much. So if you're telling someone, okay, well, go to the marketplace, now you're asking them to pay a monthly premium that they don't have money for. If you're asking them for CHIP, they have to be eligible based on income, not need, based on income. So it doesn't matter whether you have a chronic condition, although they say they take it into consideration. But I have dealt with the elderly who have multiple chronic needs, and they go to Medicaid, and it is all based on income. So I try to be the walking, talking resource. I try to take the platform as a CHO to go out there into the communities and spread this awareness, because now people are coming off Medicaid and they don't know how to get their documents together. They don't know what documents they need. It's not easy to fudge the system, especially if you have Social Security or if you have some type of other income coming in, or if you even have a bank statement, because they're going to ask you for 2 months worth of bank statements, and they're going to see that you were getting income. So it's not easy to fudge the system, even if you think you can. And you will get denied because it is hard. I mean, think about, okay, government is trying to support a lot of people medically, but it's hard to do that. It's not easy. So we have to cut people off, but they're cutting people off that are over the threshold by $25.
Mm-hmm.
What they should do is do what I think they do in other states, and that's a spend down. They do scaling, they do spend downs, they do other things that they're not doing in Pennsylvania, and that's why people are just getting completely cut off. And so I'm out there. There is right on the DOH website, you can become a helper. You can help people renew their application. If people decide to fight this, they can appeal their decision, and that Medicaid will get extended, and that'll give them Medicaid a little bit longer so that they could get themselves together and figure out how they're gonna, which program they're gonna be able to be eligible for. But a lot of times it's hard. There's brokers on Penny that can help find the best plan. I'm sorry if I'm talking too much.
No.
But you got me started. There's people on Penny.
Thank you.
Yes, it's so much. I'm always out there trying to help people with these topics. So they have Penny, they have CHIP for children that are under the age of 21, that they can get health care. And the more, I think the more family members you have to a household, the higher the thresholds are. The thresholds for Medicaid in 2023 did go higher, so not by much, but it did go higher. So some people that probably applied and got denied this year will probably get accepted. So it's worth trying to apply or reapply.
And
Where do you go again? I'm sorry.
you go to us, kind of like, we are now like your resource. We are like liaison, health equity ambassadors and things. And that's one reason why, we sit close to organizations like Sharice, if they would have us, because we have a plethora of resources. Now, it's not just information on websites, but like Frances said, she can tell you exactly where to go. She could probably, if you had someone, Sharice had someone come in the office, she could call up Frances and say, Frances, I know you work with, some of the eligibility when it comes to healthcare options. You think you could show me where that information is, or help me with this client that's going to be, looking at this information? Those are the kind of things that we can do as a temporary stopgap right now. A lot of times, again, because we're going through the organization, we're not going to go directly to your clients because you have the relationship with them. But, it's going to take a lot of these community-based organizations, the schools, sometimes, especially in rural areas, the police department. We did a distribution for testing kits to the police department because they were the ones that were going to get the testing kits out to the community. It wasn't going to be like at a health center or something like that. So we look for those partnerships with those who will come to the table and help to be those stopgap and to help to look with us in tandem for resources and information that will help people who are suffering, who don't know where to go. And that's what the pandemic did. Now we're in this transdemic. We're going to try to continue to, foster those relationships, build that trust, and be able to help you so that your people aren't coming to you saying, I don't know what to do. I don't know where to go. There's no one out there. 5 minutes. Okay. Thank you. All right. Next slide. I'm sorry, Derek.
Does the state plan on trying to make like a transitional program for people who used to qualify for Medicaid but are no longer in that income bracket? Are they gonna start offering maybe sliding scale health centers for people? Because I think that's really needed.
I was just in an MCO meeting, right? And they did not say any of that.
Really?
No, no.
Is there any way we can fight for that?
The only thing the only thing I advise is to appeal those Medicaid decisions.
Okay.
They'll extend they'll extend it. So anyone that you're speaking to that has Medicaid that gets that letter, tell them to appeal it.
I have a question.
Yeah, you have a voice, go ahead.
Because you guys have your own set department, is there a way to create a system within the system? Because the overarching thing is support, but is there an initiative that we can create that doesn't enable, meaning everybody gets a chance for a certain period of time, and we can kind of help graduate them to maybe being able to afford CHIP, penny, whatever those things are called, letting the other people who actually need it, come in, just keeping it sliding, because I think that there's a limit on the resources. That's probably why they can't afford to make healthcare free for everybody. Is there a way that we can create something inside of, like you said, you have CHO, which means you have the opportunity to make some things and some decisions. Is there something that we can do in that capacity? And in that time frame, we're educating, we're teaching financial literacy, we're getting them the knowledge they need to make enough to be able to then not be dependent on the system. Because this is a codependency, whereas though some people are afraid to get off of it because they're then for the first time in God knows how long responsible for themselves. So is there something that we can do to change that narrative?
So many people are stuck. Me and you, we are at that age where we work. So a lot of people are elderly. They can't work. They don't have the ability to work.
Right.
Or people are just stuck on their own inability to do certain things. So you're right. There are people like me and you that definitely get to where you're staying, but then there are certain people that cannot.
Right.
And so for considering the numbers, it might be most of those people that are getting affected by this situation.
Like the older people.
The older
So now
people and the younger kids.
So here's my question with the elderly, because I actually care for an elderly person. And there's a few others, her friends, they wanted to go into homes and stuff like that. The first thing that they do when you sign up to be taken care of in a home is they take all of your assets. Everything that you own, opposed to telling you how to manage your assets so that you can properly. And not everybody has an asset, but to sign into that type of home or housing, they take what you have. That's not good. It literally is not even fair. It's highway robbery because this person will be in the system and they'll die and you'll end up getting way more than they technically owe, right? So there are some older people. Trust me, I know. I got some older people.
It's completely injustice.
Yeah.
So we have to be the advocates for them. We have to advocate.
But you're saying the only thing that we can do is literally just like speak up and appeal. There's nothing we can do.
Right now, that those are our choices, and then we can continue what you're saying. Yeah, those are our choices right now.
Because it's kind of like, it was coming. And once the decision was made, May 11th, even with vaccinations, which is one thing that we do, we help to, partner with trusted organizations in the community, like say your faith-based organizations, churches. My church has a food pantry that also, they have a vaccination clinic to be able to, utilize those trusted partners because that's where people are going to go. And like you said, with certain certain races and ethnicities and things and social groups, some people stick together. We have to get to those leaders and people who, will be the voice for those people. Like I use in the Amish community, like in rural America and things. You have to know the elder or the whatever the title is of the high-ranking faith-based leader, because that's who they're going to listen to. And so that's why it's been really unique for us to try to form these relationships with schools, who some people say, don't come in my kid's school, I don't want you here. But now with this pandemic, they say, well, we might need the help from the state. They see where it could be helpful to, have those relationships. And we have some forums and platforms within the Office of Health Equity, David might talk about, that again, we're trying to set up an infrastructure that people can come to us and we can start trying to at least have something for people to come to the table. We have a state health improvement plan and things, and we're planning for things for 5 years out now. So when we get community organizations come to the table, it can be in those types of forms at the high level, but then we can have engagement staff who can go into communities and start to hear from people and start to find out, well, what are they asking? What are they saying they need? How are we going to need to engage to be able to help these people? Because we just can't let, whole populations of people just go by the wayside in 2 months, and expect food pantries and, food banks to do double or triple what they're doing already on a shoestring budget. So we're trying to listen. We're trying to be out there, just to get your feedback. But I know I'm just about out of time here, but if you could just go through a couple of slides, but some of these things are just talking about, breaking down some of those issues with social determinants of health and things that, are some systemic policies and things. Some things we don't have any, I won't say we don't have any control over it, but the initial decision, like Francis said, it's not something that, we can do something about, but there may be workarounds. And as you're working with that, here you go again, with someone, we can tell you, again, try this, do this, and each person at a time, each family at a time, hopefully they will start, and then we can reverse some of those, was talking about, generational curses, thank you. Because sometimes people don't know. It's just a matter of education, to start the conversation. Like when you were speaking about things that, who knew life insurance could be leveraged like you? I wasn't quite following. Oh, I have a college degree, but I said, I'd like to hear a little bit more. Because there are ways that we can. And so if you just scroll through a couple more real quick. Like I said, we're here in a more rural population, rural area because of the geography. Keep going. We know access to food and nutrition is really, big. One thing that, and think about the children and some of the food shortages and things in the schools, because when the pandemic hit, some kids, that was their only meal. They were going to get lunch, breakfast and lunch at school. I know my church did a program. And the kids came to the school and the parents brought them to our church to be able to pick up a meal. And that's why, again, you have to think about in terms of emergency preparedness, because there's a lot of people who are coming in. There are a lot of things that are happening. You don't know, what could be manufactured, as they're kind of saying, with this pandemic, or it could just happen naturally. We want to be able to raise awareness and for you to be thinking about not just as the community organizations, but in your homes, mitigation strategies and things that you can do and be prepared for, and start these conversations so that we don't have to start over each generation, and we're not starting over at the top, we're starting off at the very bottom. So keep going. Housing, what happens when it has implications on your health, like obesity and things, the way the environment is built. Got to think about those things. Keep going. Keep going. Quality healthcare, the environmental hazards we talked about. Keep going. Safety and trauma. I know when you ladies were talking earlier this morning, I heard someone say at a conference, trauma is the new gateway. People are suffering, and they were suffering pre-pandemic. They're suffering even more now in this pandemic. So we have to keep an eye on those things for our mental health and substance abuse, and just our physical health, all those types of things. And what's going on in people's minds could, be facilitating some of these things towards individuals and towards communities. Safety and violence, transportation, food, again, tourism, people coming from other places and things, needing more health services. So we're here to help. Our program, again, keep going. The community health organizers, you can get in touch with us because we're trying to promote healthy behaviors under the Department of Health to prevent the injury, disease, and ensure safe delivery of quality health care for all. And that kind of aligns with some of the things with our mission as the Office of Health Equity, in raising awareness, advocacy, collaborating, having measurable and sustainable improvement, because that's what we really want to see. That's our program. Keep going. I talked about the things that we kind of focus on, those main kind of social determinants of health and chronic conditions to try to impact. Keep going. getting away from the podium. Some of the programs and partners that we have partnered with, some were even here today, like recovery programs, the United Way. They have great opportunities and some things, you know, non-traditional kind of partners in the rural areas, 4-H clubs, you know, migrant associations and things, all those types of things. We got to keep thinking about this to see what happens in the future. And then just to end, keep going till, let's keep going. We're trying to bring the resources together through our office, align and not duplicate efforts. If she's doing something that's working, we're not going to come in and try to take over. We're going to try to see what we can do to listen to you, to help to provide better resources and information. And I'll provide Therese with some of these resources and things that she can distribute to anyone who, I know they took your email addresses, some of the program links. There's those things for Monroe County that I was talking about. We want you to live your best life. We want you to continue to get those screenings. Remember, this month is Nutrition Awareness Month, also Women's History Month, but autoimmune awareness and some different things in the health front. Keep on. They talked about self-care. We have some steps and things that we took off of our website to try to remind you to take care of yourself. You can't take care of anybody else, okay, Sharice? And then last but not least, we passed out some slips that you can use we want to try to break those chains. We want to try to release those shackles, you know, because shackles are not just on your hands, but they're on your feet. But think about some of those things. You can put those together and look at them and look to dismantle those in your life. Because in case no one has told you lately, you're amazing, you're strong, you're brave, you're wonderful, kind, loved, worthy. There's no one like you. The world needs you, and we want you to be your healthiest in order to do that. So thank you so much.
Thank you.
Apologize for being late a few minutes.
Thank you so much, Angela. So much good information. I just kind of feel like we don't have enough time. And sometimes we don't. It's only just 24 hours in a day. I'm about to sleep 16 of the next 24, okay? Because that's necessary. Get your sleep, it's necessary. While we set up for the panel discussion, no, we were scheduled to have a break here. I'm not gonna do a break here. I'm just gonna go into the next segment, because we do have to be done and out of here by 4 o'clock, okay? And it's been a long day for you guys. I do appreciate you hanging in there with us, you know, to take the information and things like that. One of the things I do want to share, and we can start bring them up while I'm talking. We can bring chairs up, those tables. If you guys can help me get these 2 tables set up here and the chairs. Any men in the room? Any men? Any men in the room? If you that table in the back, this table here, could you please just line them up here and get the chairs up here for our next segment? One of the things